about depression, for instance, that's something that's very highly comorbid with a lot of other physical ailments, and they go hand in hand. So that's where that idea really came from first. And then the other arm of it too is the medications we use. They have a lot of metabolic burden to them, and by that I mean a lot of weight gain associated with it, a lot of issues with controlling your sugars, and sometimes we follow up the blood work. We kind of follow those things, but we're not directly tackling some of those side effects. So I think it's a responsibility for us as physicians to address both sides. So I think for both of those reasons, it really got me interested in looking at the field of exercise to kind of both help treat, but also prevent some of these side effects from medications that someone might be on, and looking into ways on how we could do that better.
Boy, do I love this. I've been a big believer of movement is medicine, and not only for the physical side, but the mental health side. And you're part of that solution in terms of creating that evidence to suggest that. So give us a sense of, like, has this been studied? Has this been looked at, whether we're talking depression or any other mental health disturbances? Like, what's the level of evidence that's out there that exists?
Yeah, that's a great question. And I think it's an area that's been rapidly growing more recently. If you were to look at this, say, 20 years ago, and you said, I'm going to prescribe someone exercise for depression, for instance, they'd look at you like you're crazy, right? And over time, though, the literature has built up more and more and more, which is good to see because we have more solidified evidence to really see the antidepressant effects of exercise. So much so that I believe in the last year or two, there was a meta analysis that was published, or a network meta analysis, that was able to compare the different interventions. So when we're in psychiatry, we often are met with this dichotomy of, do we prescribe medications? Do we do therapy? And it's just kind of simplistic terms. That's kind of what we do. And there was not really a whole lot in between. And what we're seeing is interesting. The evidence base now is that's comparing these treatments shows that their effect on depression is pretty similar. So when you're looking at medications, therapy, exercise, and those are all very broad terms. I acknowledge, like, there's different types of therapy, there's different types of medication, there's different types of exercise. But across the board, when you're looking at randomized control trial data, the effects or antidepressant effects are pretty much the same, which is reassuring. But again, there's a lot of nuances that we can speak about in between in terms of the differences. And one that I'll quickly highlight is, as I mentioned before, the multi-system benefits of exercise. So again, it's not just treating the depression per se, but it's treating other physical ailments that may be there, or bolstering someone's physical reserve that might be there.